To complete Chapter 5, we will first take a look at the distribution of drugs through the body. Once a drug enters the body, there are four processes involved. The first, absorption, is when the substance enters the bloodstream. The second, distribution, is the movement to the brain and other areas. The third is metabolism, or the breakdown of a substance, and then elimination, when the substance is removed from the body. The most common ways of elimination are through urine and feces. In addition, small amounts may be eliminated through other routes such as sweat or exhaled. In this four-step process, it is important to take into consideration some additional factors. The first is under the umbrella term of cultural factors. There are two specific examples I will highlight. Looking specifically at the breakdown of alcohol in the body, there are two key enzymes that are involved in that process. The first enzyme is ADH, or alcohol dehydrogenase, which help to break down alcohol once it reaches the stomach. ADH converts alcohol into acetaldehyde, which is very toxic and carcinogenic, so it needs to be broken down quickly. This is done via the second enzyme, aldehyde dehydrogenase, or ALDH. Now, in some populations and ethnic groups, such as East and Southeast Asian populations, there is a variant of one or both of these enzymes which impact and interfere with the typical metabolism and elimination processes. This impact can result in more acetaldehyde staying in the system. As acetaldehyde accumulates, this can cause a range of consequences such as flushing of the skin and nausea. In addition, long-term consequences are also possible, as this accumulation has been linked to accelerated alcohol-related medical issues such as cirrhosis of the liver and esophageal cancer. The second example pertains to women. In regards to the above enzymes, women produce less of the ADH enzyme. This difference has been linked to women developing conditions such as cirrhosis at a faster rate than men. Likewise, there are additional factors to consider with women in substance use. These factors include different hormonal levels, slower digestion, and a higher percentage of body fat, which results in more of a substance being absorbed. These factors significantly impact the absorption and metabolism processes in women and can contribute in one way or another to accelerated substance use related health consequences. Another area to explore in Chapter 5 is the mechanism of tolerance and withdrawal symptoms. The text goes into detail of the three processes involved with tolerance: pharmacokinetic, or drug disposition tolerance, behavioral tolerance, and pharmacodynamic. A related topic in this area is the concept of cross-tolerance. This refers to the process where, if one has developed tolerance to one substance in a drug category or classification, there is the potential and possible likelihood that person will also have tolerance to a substance within that same category. To finish up the chapter, let's do an overview of the most common routes of administration discussed in the text. The first is oral. This route may be simple and convenient to take, but can be a complicated way to enter the bloodstream. This is due to the way a substance usually has to move through the digestive tract. In addition, rate of absorption can be impacted by factors such as presence or absence of food, enzymes, and solubility, which can impact how fast or slow a drug's effects are produced. Looking next at inhalation, this is the system used for smoking various substances as well as huffing substances. Onset of effects is very, very rapid as the drug gets to the bloodstream through the lungs. However, while the effect is fast, it is also quickly lost. Next is injection, which involves delivery of the drug through a hypodermic syringe directly into the bloodstream, as in the case of IV injection, a muscle mass, intramuscular injection, or under the upper layers of the skin, subcutaneous injection. This is generally viewed as a very dangerous route of administration due to potential exposure to a range of health issues, possibility of infection, and pain related to the injection process. The last route to look at is topical and the subcategory of insufflation. This involves the delivery of the drug through the skin and/or mucous membranes. Depending on where the substance is applied, absorption rates can vary from rapid to slow and steady over many hours.